So if you had to go back and give advice to your younger self or even to the newest, youngest chiropractors out of school today, what would that be?
You know, I think what I would probably say, and again, like I can't convey enough how much of a simplistic person I I actually am, and even more how I want to be and desire to be. I think the big thing that I would say is that you should really set up your determine what type of life you want. Determine what type of life you want and create a practice that supports that. In our society, we have the tendency to talk about this work life balance, but work is something that you do in your life. It shouldn't necessarily be balanced with the totality of what is the rest of your life.
Yeah.
Right. So I believe that you should know or start to really think about what type of life you want and then create your practice to make sure that it's supporting that life, right? So for me, because I am a person who I don't want to spend a large amount of time working. I don't want to, have that stress of a very high volume type of practice. That's not the type of practice that I have tried to create. And patients actually appreciate that. I just recently had a patient who she was seeing me wellness, then she got a job at another chiropractor's office. So she called me. She said, "Hey, I got a job at this office and they provide complimentary care, so I won't be coming back." And understandably, and then she came back about maybe 2 months ago, and so she said she's no longer working there. She said, "But I just totally didn't like the vibe, like, I just feel more relaxed here in this environment." They were seeing and she was in charge of scheduling 200 patients a day, and so I'm trying to figure out because she said
Wow.
she had to schedule 4 patients every 15 minutes. That's not me. I couldn't even operate in something so high volume like that, right? So, while that sounds good from a business standpoint, and I know those type of things are kind of promoted, if that's not who you really are as a person, then that's not the type of practice you should be attempting to set up, right? So, I don't think that we necessarily have to make our practices extensions of us per se, but it should also not go against the type of life that you're ultimately trying to live.
Right. So the two you're saying the practice life and your home life should kind of work in harmony.
Absolutely. If
Yeah.
if you if you want a very simplistic, low stress type of lifestyle, it wouldn't make sense to set up a practice that's high stress, right?
Yeah.
That is going to require you to constantly, be at the office, stressing out, trying to acquire more patient, or as we say, stay on the grind, right? If that's not who you are or the type of life that you want, then it doesn't really make sense to create that type of practice. And so, again, it doesn't necessarily have to be exactly you, all of your likes and none of your dislikes as far as the actual care, right? Like I love to be adjusted diversified. I love to be adjusted diversified. And I tell all my patients, I I prefer to adjust diversified because that's what I like, right? But if you don't like it, we won't do it, right? We can do something else. And so, again, it doesn't have to completely mirror who I am as a person, but overall, as far as the type of practice that you have, it should be supportive of the life that you're trying to live. I do not believe in a work life balance. My life is all of that for which work is a part of. I'm not going to balance my life with work. Work is a part of the pie. It's not the pie, right?
Right.
So I think it needs to be reflective of the type of lifestyle that you're trying to live.
Great. So what's your vision for your future in chiropractic practice?
So, you know, if the shoulder continues, then I probably have some more years doing what it is that I do now. If you talk to me tomorrow, I might be about to quit though. The
Is it
shoulder
all
is
our left shoulder? I think everybody I talk to, it's always the left shoulder.
and so now you're right dominant.
Yeah.
Yeah, and so, I was just trying to figure that out, like, why is it my left when I do everything with my right? But I'm thinking, this is my 2 cents, right? Might not be right, so don't hold me to it. I'm thinking it's because we're so we're so familiar with our right, we trust it so much, right, that we just do what we do with the right. But I think
Mhm.
with the left, because I'm so right dominant, I'm a little awkward with my left.
I'm
And so
like
I
that
might
too.
be trying to compensate with just strength and force, right? Where I don't have the finesse. I don't know, but it's definitely my left.
Sidebarring this, we'll talk about this at another time, but you know what I realized I do, which is why my left shoulder is so terrible? When I have
Hmm.
cervicals and I'm adjusting somebody's neck, I am so sloppy on that side and it's just killing my AC joint. And then I go sleeping on my arm. It's terrible.
Yeah, this is a real thing, and I don't know where that came from when I sleep, but
Yeah,
it's also yeah, for sure. Yeah.
it's
But well,
terrible.
even
But
still, subconsciously, we might be doing that because there is something going on with the shoulder. But yeah, it's definitely the left shoulder.
yeah,
So if that continues to be a problem, I guess maybe in the short term I'll go to a little bit more instrument adjusting. I don't know. But ultimately, what I would like to do is at some point definitely get away from the physical part of it. What that would look like, I'm not sure, but I want to do something that would allow me to have greater access to my time and flexibility because the thing is most people think that because you own your own practice that like you have access to your time and you
yeah,
can be flexible, but the reality is you still have to be in that practice enough to make it worth people's while to come and see you.
absolutely.
So you can play around with it a little bit, but you pretty much got to show up every day and you got to have a pretty nice schedule. But I would like to do something, and I don't know what that is yet, that would allow me to still work for the profession, in the profession, but free up some of my time to allow me greater use of it. And, obviously still generate income. I just don't really know what that is just yet.
Fair enough. So backing away from being the technician and kind of moving into a influential role
Mhm.
is what I hear
Yes.
you saying, right?
Yeah.
Okay.
Yes.
Gotcha. Very nice. Yeah, that makes a lot of sense. And what a nice thing when you figure that out because
Right.
that's like a whole other level of influence, which is great.
Hmm.
So
Hmm.
so is there anything? I mean, we talked about a lot of stuff. We had a lot of little sidebar conversations. So